going to tell you one important topic in sports injury is the repair of the Bankart through the arthroscopic approach. This young gentleman is having injury while playing basketball, and after that he fell on his right shoulder, and this is now more than 6 months. We tried physiotherapy and intra-articular injections, but there was no relief, and after that we did the MRI, which shows the anterior Bankart lesion. And so this is the MRI of this young gentleman in the axial fat suppressed view, and you can see that this is the anterior part of the glenoid, and which is detached from here, and it's little bit elevated also. And when we are going to see in the sagittal view, so in the sagittal view you can see this area, there is a haziness, and so this is the area of lesion now, which I am going to show you in the arthroscopy. So now I will take you to the steps of the arthroscopy. So this is the arthroscopic view of anterior Bankart lesion, which is showing from 1 to 5 o'clock position, and which I am going to do the repair, and this video is for the reference. So in this anterior labral tear, I am doing with the single port technique. You can use the double port technique, whatever convenient for you. And in this you can pass the lasso or suture passer, and then you can pass the loop wire, and then you can retrieve it either with the same port or just make another port and try to retrieve it, and then you can pass the fiber loop. After this you are going to do the drilling over the glenoid, like this is 2 to 4 millimeter away from the glenoid margin, and after drilling just put the push lock suture anchor by tapping the suture inside, and there will be a mark. Until there you have to put the suture. So now I am preparing the bed of the anterior glenoid, and this is the rasp I am using. Try to rasp in such a way that some bleeding will appear, which is going to help, and you can use a little bit of saver also. And now I'm going to pass the lasso or suture passer, and you can see this is the blue color fiber loop, and try to push inside as much as possible. That will be easy while going to retrieve the fiber loop, because this is going to help when you are going with the single port technique. And then over this I am going to pass the fiber wire, and then 2.5 mm drill bit we are going to put 2 to 4 millimeter medial to the glenoid margin, and maximum 2 to 3 sutures you have to put it. And after drilling you put the guide wire, and then you can put the, after removing the guide wire, you can put the push lock suture anchor by tapping. So this step is a little bit crucial because sometimes we miss the place. So when you are in the well aligned position, then only remove the guide wire, and after putting this, you can see this, the anchor is going inside. I am going to tap it. Hammer please. So you can just tap it, and you can see this, the marking. Until there you have to tap. This is a very easy procedure, and you really will enjoy this. And after this, once you reach until the margin, just unlock the suture screwdriver, and just remove it like this, and then after that you can cut the fiber wire with the suture cutter. So you can see this part of the labrum is well aligned and came anterior to the over the glenoid. So this is the perfect, you can say the perfect reposition of the labrum over the glenoid, and this way you can put as many as suture you want. And this is the final picture. You can see this, I have put 3 suture anchor, and you can see this labrum is over the glenoid. So, and this is the biceps. So I'm well satisfied with. Thank you.